Well, Obamacare was kind of weak tea, but that doesn't stop the Democrats from plunging ahead with health care for all. And ladies and gentlemen, it's becoming a reality. I'm Scott Ott with Bill Whittle and Stephen Green, and this episode of Right Angles brought to you by the members at BillWhittle.com. Gentlemen, in New York City, Mayor Bill DeBlasio has announced that by 2021, some 600,000 uninsured New Yorkers, including 300,000 undocumented or illegal aliens, will be receiving free health care. Not just health insurance, but actual free health care. Some others will be paying on a sliding scale, those who can actually pay something. And then, of course, the rest of most people will actually be paying full price for it. The interesting parts of this story, though, are a couple. Number one, it's going to cost $100 million, but there'll be no tax increase, according to Mayor de Blasio. He believes that the savings that will accrue as a result of people getting care at the level that they should instead of at the emergency room will save enough money that they won't have to jack up taxes. And finally, he says that everybody should have this as a right, and Democrats have said that for years, but he said it's not real, it's not practical. If it's just a theory, I'm going to put it into practice. Stephen Green, I can't imagine that any, especially a Republican, a little r Republican, would have a complaint about this. After all, we are the ones who want to see these little experiments in counties and cities and states and let 1,000 ideas flourish and see what works. Don't you agree that it's great to see somebody putting this to the field test?
Well, let them try. It's not my tax dollars.
Yeah,
But let me give you a real-world example here. I used to work summers for my grandfather, Southwest Steel Supply. The company's not around anymore. He retired and sold it off and all that good stuff. But Mary was the receptionist and the office manager, and she was notoriously stingy. I'm sure this is how she got the office manager gig. She would not give you a new Bic pen without first asking, "Where's your empty?" You had to present the empty pen to get the new one. And every single time, she would make it right some more. She would take your empty pen and she would work her magic on it and hand it back to you and say, "This still writes." So I would approach Mary all the time with ideas. I get I go through the mailers and stuff, and I go, "Mary, I know how to save the company $2,000. And she would perk up. "Well, how are you going to save the company $2,000? "Well, this 386 IBM PC is on sale for $3,000, down from $5. So if you buy that for me, I've saved the company $2,000. "No," is what she would always say in response. And that's what we're getting here. Listen, if every government program that promised to pay for itself with the savings it somehow generated, we would be sitting on a $22 trillion federal rainy day fund instead of sitting on $22 trillion of accumulated debt. So, hey, if it works, more power to the people of New York, especially those taxpayers who will be even further on the hook to pay for people who are not here legally. But we've been down this road before, and I'm pretty sure I know where it ends.
Well, Bill, it seems like the central concept here, and the thing that de Blasio keeps emphasizing, is the fact that they've got an existing problem now. It's not that these 600,000 people aren't getting any kind of health care. It is that their primary care physician is the ER. It's the emergency room. And that is the world's most expensive kind of health care. I shouldn't say the world's. It's the United States' most expensive kind of health care. Probably the cheapest in every other country. But he's saying basically, let's clear out those emergency rooms of people who have, sprained wrists and a case of the sniffles. Let's get them to a primary care physician. Let's pay for that care. We'll be better off in the long run. And frankly, Bill, then if you're a New York City resident who is paying for your own health care and you go to the emergency room, you're not waiting in a long line of people who should have been triaged out of that system. What's to criticize about this, especially if they're doing it at the city level with a mayor who got elected by those people?
Nothing. There's nothing to criticize under a few conditions. First of all, the entire funding for this needs to come from de Blasio's political base. In other words, it's not fair to ask upstate New York people to pay for this. It's certainly not fair to ask people in Arizona to pay for this, and so on. So if he's talking about funding it from within New York City to cover New York City, that'll be one of my conditions. And listen, I don't have a problem with, let me finish the sentence. I don't have a problem with government health care programs. I have a problem with only government health care programs. So if it turns out that this is a cost-effective way for him to get people who need health care covered and get people earlier treatment, which is not only cheaper, it's just better, it's just morally better, that's great. The thing that is so alarming to us about things like Obamacare is that it is heading for a national health care system, which again wouldn't be a problem if it didn't mean that it would put everybody else out of business. So now you'll find yourself in this situation where there is one healthcare provider, which is the government, and if they've decided that you're not worth the financial investment to try this chemotherapy, they give you your morphine pills and tell you go home and die peacefully. And if you've got a child with a serious birth defect and somebody does a fundraising campaign to get that child the actual treatment that he needs after he's been sentenced to death by the National Health Service, they're going to button up the hospital like a security prison to make sure that you don't take your own son out of a hospital, take him somewhere else where he can be treated to make them look bad. That's the kind of thing that I'm against. And one of the most moving moments I've ever had in my professional career was when I was up in Ottawa, Canada. It was a conservative conference there, and the person who was hosting me was a guy who ran a cancer clinic. He ran a cancer clinic for the Canadian Health Service. And he said, there's two things you need to know about the Canadian Health Service, which, of course, is their pride and joy. It's how they can tell they're not Americans because they all have free health care. Right? He said, first of all, if you think that it's one standard for everybody, which is what they're advertising, you're out of your mind. There's no way that's true. It's absolutely not true. The more connected you are, the better and faster you get in. But this is what he said. This is a guy who ran a cancer lab. He said, all the time, just many, many times a year, I would get phone calls from either friends or people who were friends of friends saying, Jim, my wife was just diagnosed with cancer. The health care service said it's terminal. There's nothing we can do. They've given her the pain meds, and they said she's probably got 4 months to live. Could you take a look at the lab results and see if there's, if there's any hope? So he would take a look at the lab results. And needless to say, the person's got a serious health issue with serious cancer. It's not a joke. But he would say, this is what he said to me. He'd say, there's a program going on at the University of Tennessee where they're trying this experimental drug. They're getting a 60% remission rate. That's not a bad bet. Let me put you in touch with them. And he said, and this is a direct quote as I recall it. He said, in Canada, when the government decides you're dead, you're dead. In America, you're not dead till you're in the ground. And I thought, man, I'm proud of that. Right. So that's the future that conservatives fear is a world where your daughter's treatment is not determined by you or your insurance company or willingness to pay nothing. It's determined by some faceless bureaucrat following rules that have been created by politicians with a very clear set of numbers and a very clear statistical basis of whether or not your kid should live or die. And if you don't like it, you're just screwed. Because not only is there no place else to go, we won't let you go anyplace else. And this is the nightmare that we have to avoid. So if DeBlasio wants to provide this as a service to the poor people of New York, and if the New Yorkers are willing to pay for it on their own, super.
Hey, Bill, one other thing, though. If we screw it up here on a national level, then there's no more America for anybody to fall back on when their own national health care fails them.
No, that's why I've been looking at property in Antarctica, which is actually pretty reasonable when you get right down to it.
And kind of a minimal government there.
Minimal government, and also living in Antarctica, I imagine, would keep out the stupid.
A little bit.
As long as there are people there. Anyway, when I first heard this story, three things occurred to me. Number one was, good for them. Try something new. I always like a good experiment, and as long as we can concentrate it. I mean, I would have preferred a much smaller city, perhaps Des Moines or Paducah, something that would have been, that would affect
those places take care of themselves.
Fewer people if things went wrong. But it's good that they're trying the experiment. But two other thoughts quickly followed on that. Number one is that while we are getting a projection of the cost, if Michael Bloomberg had given me a cost projection, I might have put a little bit of stock in it. After all, the guy ran a business and knew what he was doing. But Bill DeBlasio and guys like him, I don't think have any real way of estimating the cost of a hot dog stand on a street corner, let alone the entire healthcare of some 600,000 people in the greatest city in the world. So I'm really skeptical about the cost estimates and would be highly surprised if within a 3 to 10 year window they didn't have to find other ways to fund that, i.e. Tax hikes that they promised not to do, or a higher cost of healthcare for other people to carry the cost. So it's just an inherently unpredictable business. You don't even know the kind of numbers of people you're going to have to be dealing with, because when you say healthcare for all, that's open-ended. And you say 300,000 illegal aliens now, well, how many more undocumented people are going to be coming into the city in the next 5-10 years? We do not know that. And so, yeah, great idea, inherently unpredictable. But I thought at the very least, we'll get to see them try it and then fail. And that will be an object lesson. And then it occurred to me immediately afterward, it can't fail. It's not possible for it to fail. Have you ever heard of a government program that failed? They never fail. And so it really is not an experiment, because a real experiment in the scientific way of looking at it leaves room for the possibility of utter disaster, that nothing will come out as we hypothesized, and it will be just nothing but negative data that comes out of it that says, here's a way to not make a light bulb. This is government. And there is no way to not make a light bulb in government. For Bill Whittle and Stephen Green, I'm Scott Ott. Thanks to the members at BillWhittle.com for making Right Angle possible.